So who is the Advanced Care Planning India Task Force or the collective? Who are these people who are organizing festivals around death literacy and death and dying? I'd just like to introduce you to how we got who we are, how we got here, and what we hope to achieve with all of your support. So, like Roop has already, he's already alluded to what advanced care planning is all about, and so I won't go into the details of it. But the judgment of March 28 on a petition filed by the NGO Common Cause affirmed the constitutional validity of citizens' rights to autonomy in healthcare choice. And in 2023, when there was an amendment made to the judgment, that's when it really came into play. Some of the barriers were removed. And in February 2023, a bunch of us got together at an Indian Association for Palliative Care conference in Ahmedabad. And we thought to ourselves, and we got together, we discussed it actually, and said, what can we do about this? And so we sort of started having conversations informally at that time. And in that year, a lot started to suddenly happen. Things started picking up speed. Lots of people started talking about it. And what we found was that there was a lot of misconception and a lot of misunderstanding of what dying in dignity means. And people were conflating it with euthanasia, with active euthanasia, with physician-assisted suicide and things like that. And we really felt a need to clarify these doubts that people have and to stop these myths from snowballing into something that they weren't. And so how do we do this? In order to take charge of our last days, we have to not only overcome the taboo on discussing death, but also familiarize people, and that's what we're doing here today. So advanced care planning, like Roop said, is a medium by which your choices are tangibly employed, and it is operationalized through very specific pathways like the advanced medical directives, like DNR, like organ donation, and so on and so forth. And historically, advanced care planning and palliative care did not evolve together. Advanced care planning has its roots in the US, whereas palliative care has its roots in the UK. And so even as we do this, I think we're only the second, after advanced care planning Australia, this is only the second country that has an active advanced care planning collective. And so that's how nascent things are. And in that way, this is a great opportunity because all of you who have taken time out to come and be part of this, you're walking with us right from the start. And you don't have a lot to catch up on, so you can join us now and make this a stronger movement. And it is precisely for this reason that all of us have convened. Who we are, you met Dr. Roop Gursani. He is a neurologist with PD Hinduja Hospital in Bombay. Dr. Savita Butola, who couldn't be here today, unfortunately, she is the DIG, medical DIG of the Border Security Forces, who's now stationed in Srinagar. Me. We have Dr. Dhwani Mehta, who's not here, unfortunately, one of the most, I would say, vital forces behind all the legal changes that are happening in the country, and we're sorely missing her today. And so she is the co-founder of Vidhi Center for Legal Policy, and she heads the health vertical. Dr. Rajni Surinder Bhatt, very own Bangalorean, who is a pulmonologist, also trained in critical care and palliative care, and is with Sparsh. Dr. Sunil Kumar, who is not here also, he's the director of the Trivandrum Institute of Palliative Sciences with us at Pallium India. We have Dr. Smriti Khanna, who is the palliative care consultant at PD Hinduja Hospital, and also the person to start the first living will clinic in the country. And so if you want to have a conversation with her about how that's going and what lessons you can take back, she's going to be here tomorrow as well. So please find her and have a conversation with her. Dr. Parth Sharma, possibly our youngest task force member, who has more publications to his name than years to his life, and is collecting degrees like a thermometer. But he also lends us the energy to really get things going on the ground, and he's a community physician and a public health researcher. But none of us can really do this without our supporting team, and we have a very, very robust and very energetic team. At Vidhi Center of Legal Policy, we have Hardik Dua, who has been instrumental in putting this whole festival together. He is the Advocacy Officer for Health. We have Rituparna, Shireen, and I don't think Nikhil is here, but Rituparna and Shireen are here. Nihal, sorry. And, I don't have my glasses. And also Shreyashi and Kim. From Pallium India, we have Binod, who is our chairman. He's here today. Shreya Singh and Shayan, who have just been keeping everything going in the last 24 hours, and even before that, of course. And from Nivarna, we have Gayatri, who has illustrated a wonderful handbook to be used in the community, which we will be sharing with you a little later, and Akshay, who has now created a website for our task force. So this is all of us, and you can find us over the next, over the whole day tomorrow and have conversations with us about whichever area interests you. So what are our key objectives? We try to make this as succinct as possible, to make advanced care planning a reality in India and to improve death literacy. What will the benefit of the change be to the healthcare system? We should have reframed this as what will the benefit be to you, the person who uses this system. More patient-centered goals of care. You will be able to participate in your healthcare journey. You don't have to be a recipient of care, but you're a co-creator of the care that you receive. India, the financial toxicity associated with healthcare in India is staggering. 55 million Indians are pushed below the poverty line annually because of out-of-pocket expenditure on healthcare. So a system that is supposed to alleviate suffering at the moment is afflicting suffering. And so what advanced care planning is going to allow you to do is reduce that toxicity by making decisions in advance. And this is a huge reason why you should write your advanced medical directives. So we thought, and Roop, maybe you can correct me if I'm wrong, but when we first started talking about it, people said, yeah, but this is such an elitist idea. Educated people or people who are of privilege will write their living wills. 40% of people who wrote their living wills in Kerala, which right now is the leading state for the number of AMDs written, were people who were fishermen and farmers. And it's been documented because they don't want their families spiraling into financial toxicity. They don't want their children dropping out of school. They don't want their homes mortgaged. So 40% of the people who've written out the AMDs in Kerala are people from the fishermen community and the farming communities. So it is for everybody. And we do have the AMD available in Tamil, in Kannada, in Malayalam, and in Hindi as well. So we are working on getting it, making it available in various languages across the country. And of course, greater efficiency in hospital resource mobilization and utilization. So even hospital systems will benefit from it because you're not allocating resources to people who you should actually be thinking about transferring them home and making sure that they're getting care at home. And how will it impact you positively in other ways? Like I said, it'll allow you greater autonomy in your decision making, facilitate a dignified death, whatever that dignity means to you. Dignity means different things to different people. And part of the reason we're here today is to reflect on that. What does dignity mean to you? It could be very different from the person sitting next to you. Reduce emotional stress, anxiety about decision-making processes at the end of life for patients and caregivers. How many families here have experienced conflict because siblings don't agree on what kind of treatment their parents should get? I have seen on more than one occasion a sibling who's in in another country, and the caregiver who's on the bedside constantly arguing about what the money should go towards. Roop and I worked on a case where one sibling was in the US and she wanted to buy her mother a water bed or an air bed that cost about 1,20,000 rupees. And the caregiver who was right there said, no, she's fine. I think she needs pain relief and pain management. Sometimes the guilt of not being the caregiver at the bedside forces people to overcompensate in other ways. So if you have an EMD, maybe you'll reduce friction at home when the time comes. And illnesses, making critical decisions, it happens at a very emotionally volatile time. I mean, inevitably it's an emotionally volatile time. And how will it affect access to palliative care? Hopefully, it will create greater demand for palliative care by raising awareness that palliative care is available as an option. You can be made comfortable. We will walk with you right to the very end and beyond with your family. So please ask for better access to palliative care while you educate yourself on advanced medical directives, and create an enabling policy environment for palliative care, and we're seeing the beginnings of that happening right now. How do we plan to take this forward? Public engagement, targeted workshops, sessions, not just with lay people, but also with the legal fraternity and the medical fraternity, two notoriously difficult fraternities to break into when it comes to this, contrary to what you might imagine. Definitely need more media coverage on it, and a creation of short films and information and education materials. We need to mobilize resources around this, and that can be done with assistance and engagement, not just with the public, but also with the government systems. Historically, the problem has been not just in palliative care, but in healthcare, also in other areas, I'm sure, that we look to the West for evidence. And policies are designed based on evidence generated in high-income countries. And very rarely do they fit contexts like ours. So we have to build evidence in our own contexts. We have to understand what is needed on the ground here. There's a big debate, happening around the world, which some of you may not know about what constitutes a good death. And there are people who will tell you what a good death is. It's, well-medicated, at home, with the healthcare team, in full support, etc. And it's not a reality for most part of the world. And I won't call it the global south, I'll call it the global majority does not have access to that kind of a good death. What does a good death look like in a remote village in Ladakh? What does it look like in Arunachal? What does it look like in Chhattisgarh? So we have to be context specific as to what it is that we're looking at. And so for that we have to build evidence. And of course, policy reform is one of our objectives. And finally, all of this is great, but without implementation, it means nothing. So that is our final objective, and there are short, mid, and long-term goals that we have. So finally, I'm just going to invite Parth. What we have created for you, and there are QR codes that have been put around the venue. Please scan them, because that QR code is going to take you to a toolkit. And this toolkit is what Parth is going to tell you about. It is very practical, it is very easy to use, it's user-friendly, so please use those QR codes, and Parth will tell you what exactly is in that toolkit.
I was supposed to start with a dark joke, but it was censored. So I chose a political joke instead. So nothing in life is certain, like we all know, except death and taxes. Now, we can't promise to simplify GST for you, but we have created a toolkit to make advanced care planning, and even those tough conversations around death with your loved ones a little easier. So we are sure after this toolkit, death might seem simpler than GST. This toolkit consists of a ready reckoner, which covers the landscape of legal framework and current status of ACP across India. We have a set of frequently asked questions which are targeting both healthcare professionals and patients and caregivers. There is an estate planning document which covers everything you need to know about managing your assets and securing your family's financial health. And what we are most proud about in this document is that it highlights a section which is specially made for women, irrespective of their marital status. There's a document called the Queer Legacy, which is an estate planning guide for the queer community. And finally, we have a community engagement guide, which, through a conversation between a grandmother and a grandson, explains why advanced care planning matters, what an advanced medical directive is, how to choose your healthcare power of attorney, how to state your values, healthcare goals, make treatment choices, communicate them with your loved ones, and finally, how to complete the advanced medical directive. And this booklet is like, all these sets of these booklets are like user manual for the last chapter of your life. And let's be honest here, out of all the manuals you have ignored so far in your life, we are only hoping that you'll read these ones.